you're going to say interstitial, you either have to say moderate or severe. If you're going to say alveolar, moderate. Alveolar, you can say mild, moderate, or severe. Because anytime you see alveolar pattern, that's going to be abnormal. But a mild interstitial, you're on the fence. Everybody got that? Now you can use it, but it doesn't really mean anything, so you're on the fence. Okay. I would take anywhere from a moderate, severe, interstitial to a mild alveolar. And you actually do see abrochorams. And you're seeing them right here. So they're not, the lungs are not so opaque that they look really beautiful. So, but even, you would be correct, even if you said moderate. I take that as well. So which means then, your radiographic diagnosis would be left atrial disease with signs of left heart failure. That'll be your radiographic diagnosis. Okay, let's do pulmonic stenosis and aortic stenosis. So when we talk about vasculature, either conditions are going to cause normal, no change in vascular size, change in the arterial size, or change in the venous size. And you had that already. So you have to determine whether the arteries are larger than normal, the veins are larger than normal, both are larger than normal, both are smaller than normal, etc., etc. But these two conditions cause typically a normal vasculature. So you look at the clock analogy. If you're thinking of pulmonic stenosis, you would expect to see enlargement of the main pulmonary artery from post-stenotic dilatation. And again, on the left side. And then aortic stenosis, post-stenotic dilatation. So you'll see a bulge on the left side on the DV. And then you look for loss of cranial cardiac weight. Everybody with that. Great. Now, so what does it look like? So this is referred to as a selective angiogram. So you actually place a catheter into selective part of the heart. Not where you just inject contrast material in an artery or vein and then just let it flow through the heart. But this is one where you actually want the contrast injected on in a specific chamber, in a specific great vessel, or in a specific part of the heart. We don't do this anymore only because of echo, but I wanted to show you a picture so when you see it on an echo, you'll see what it looks like relative to an image. So this is the ventricular artery catheter that's placed in the right ventricle. We know it's right ventricle because it has these irregular margins from the porting tibia. The injection was made. Look at the narrowing out of the right ventricular outflow into the main pulmonary artery. See the narrowing, let's say irregularity. So when the right ventricle contracts, even though it contracts really forcefully, then it's trying to get through a narrow area and the blood then ejects and hits the other side of the main pulmonary artery, and it causes this post-stenotic dilatation. So here's the left artery to the left caudal lung lobe and the artery to the right. So this is referred to as post-stenotic dilatation of the main pulmonary artery from pulmonary stenosis. So that's what pulmonary stenosis looks like. Now, if it's severe enough, then what happens with the right ventricle? It becomes markedly enlarged because it's still bringing bringing blood flow from the right side of the heart. So it becomes markedly enlarged. Then what happens with the vessels? They become smaller than normal because there's not enough blood flow leaving the right ventricle into the outflow. Okay, so that's what I mean when I say severe pulmonary stenosis can cause a hypovascular lung failure, but typically you see a normal lung failure. Aortic stenosis. Aortic stenosis is usually subvalvular. And here's another ventricular. This is a pigtail ventricular artery catheter, contrast material placed in the left ventricle. Notice the narrowing. This is where the aortic valves are, this little bulge that we see here. And notice this post-stenotic dilatation. Now, a little thumb, rule of thumb. The diameter across the aortic valve and the diameter of the ascending aorta should be, the ascending aorta should be less. And so if it is the same width as the measurement across the valves, that's a sign of aortic stenosis or dilation of the outflow tract. So just a little bit of rule of thumb. Okay, okay, let me repeat it. Because you're going to go for echo, you're not going to need to do this. I'm just saying a rule of thumb now, just in case. Because you're going to see the ejection of the, okay, got that. So if you did a measurement across the aortic valves, and then a measurement of the ascending aorta, the diameter across the ascending aorta should be less than the diameter across the valve. And if you get a measurement from here to where the dilatation is, it's probably more, larger than across the valve. That's how we diagnose it. And I mean, but this one, subjectively, you can see that it's a post-stenotic dilatation. You can see that. Okay, so that's an example of aortic stenosis. And notice again where it's located, so then you would see loss of cranial cardiac place. Hypovascular, okay, was there any other questions on that? Okay, I think you all just wanted to repeat that. Okay, hypovascular lung fill, and we think about conditions, most common cause, blood loss, hypovolemia from blood loss, abscess disease, dehydration. Dehydration is a common cause, believe it or not, for hypovascular lung fill. Pets that are traumatized come in shock. That is like the #1 cause of a hypovascular lung fill. We don't see it a lot when we take the radiographs because the pet has been dehydrated. You know, fluids and been monitored, etc. And of course, there's severe pulmonary stenosis and right to left shunting lesions such as tetralogy, etc. We're going to talk about tetralogy in a minute, and a reverse PDA. Talk about that. This is an example. I think this one is also on Dr. Carter's PowerPoint presentation. And for this one, you can see that the heart is small. And for the size of this pet should be at least 2.5 intercostal spaces. And this one is 1, a little bit less than 2. Deep-chested dogs, it's common to see the heart sort of off the sternum. That is not a pneumothorax because you should not see vessels with ventral to the heart. Vessels are very small, hypovascular in your measurement of the vessel to the cranial lung lobe. Remember, there is no measurement caudally. You will want to use the cranial because that's where the research project was done. And so we can use that predictively on the condition. Notice the very, very, very tiny caudal cavity, just barely can see it on hypovolemia, hypovascular. Okay, let's go over tetralogy of the lung. 4 parts of tetralogy. Now, when we say overriding aorta, they're not transposed. It's not that the aorta is on the opposite side. The aorta is receiving blood from the right ventricle and the left ventricle. It's sitting right over the VSD, which is the second part of it. So it's sitting right over the VSD, and you're going to see why that's important in a minute. And what's associated with this condition is severe pulmonic stenosis. And we already talked about it. If he had severe pulmonic stenosis, what's going to happen to the right ventricle is become markedly enlarged. So then there's right ventricular enlargement. Because the aorta is sitting over both chambers, when the blood leaves the right atrium, the right ventricle, then where does it go? Into the aorta. And so it is non-oxygenated. And that's why those pets are cyanotic, cranial and caudal. With the reverse PDA, they're cyanotic caudally. We'll talk about that now. This is a condition that is repairable. And actually it's common in males. Actually, my nephew had it. And he's still with us. Married, got children. So it is repairable. So it's not the death. And keep in mind that some of these conditions just refer that the owner has funds for paying for the correction that can be corrected. Okay, so the blood flow then, when it leaves the, so look at the blue, as it leaves the right ventricle, and if there's severe pulmonic stenosis, look and see where the aorta is sitting. Now you have to have a VSD in order for that to occur. Because if you didn't have a VSD, of course the pet or the person would succumb in utero. Well, right after birth, not in utero, right after birth. Okay, so from congestive heart failure, because the blood has to get out of the heart. Okay, so it leaves the right side. Now why doesn't it go over to the left side? Because of the increased pressure. That is correct. Now, the increased pressure on the left side is not, typically you see turbulence in this region. And then, of course, when the blood leaves, when a little bit of blood that goes into the main pulmonary artery, into the lungs for aeration, and then back on the left side, then that blood then is going to mix in with the unoxygenated blood, right at the VSD. So, and that everybody understand now why they're cyanotic or cranial. So that's the tetralogy of flow. One of my very favorite conditions with the overriding aorta position over VSD, and I talked about that. And then this is just another way of saying how the blood flow, right atrium to right ventricle, and I've asked, well, where does it go next? Right into the aorta because it's overriding the VSD. Hypervascular lung field, I'm just going to introduce this and then we'll start with conditions. Hypervascular lung field conditions tomorrow. So when we say hypervascular lung field, if you use that term, you have to tell me, are you talking about the arteries that are larger than normal? You have to tell me if you're talking about the veins that's larger than normal. Or you have to tell me if you're talking about arteries and veins larger than normal. The most common cause for enlarged arteries is going to be heart rate disease. Let's not go all off into the wherever. Please, if you got large arteries, your first differential is going to be heart rate disease. There's not very much more that cause arterial enlargement in pets. There are some, but that one is number one. So then if you think in heart disease, then you should look at the heart and see if there's a main pulmonary artery enlargement. You should look and see if there's loss of cranial cardiac weight to confirm it. Not just looking at the artery, but for other findings as well. Veins larger than normal. We've already talked about that. Mitral valve disease is going to start repeating. Mitral valvular disease is the most common cause. Once you get through that, then you can go through a textbook and see what else could cause that. If you have mitral valvular disease, more than likely there is a friend with it, and that's your tricuspid insufficiency. So if the pet has mitral, more than likely the tricuspid is coming next. or it is associated with. So mitral valvular disease, then the next step is to make sure that the pet doesn't have tricuspid valvular disease. If the arteries and veins are larger than normal, arteries and veins are larger than normal. If this is a youngster, you should be thinking about left to right shunt lesions. Left, because constantly overflow, hypovolemia in the lungs. Left to right shunt lesions, the most common one, PDA, DSD, and ASD in cats. Left to right shunt lesions. Okay. I'm going to start there on Wednesday. Anybody have any questions, 10 o'clock?